If a simple blood test could tell your doctor something important about your brain health, years before any memory problem became obvious, would you want to know? This year, for the first time, that kind of test became available in the United States. And today, we're going to walk through exactly what it does, who it's actually for, and just as importantly, what it cannot tell you. By the end of this video, you'll understand how this test works in plain, simple terms, what a result from it actually means, and why doctors are being careful about how they use it. This isn't about scaring you. It's about helping you walk into your next doctor's appointment feeling informed, instead of confused. For a long time, checking for Alzheimer's disease meant one of two things. Either an expensive brain scan, called a PET scan, which can cost several $1,000s and involves a small amount of radiation, or a spinal tap, which most people understandably want to avoid unless there's a strong reason for it. That made a real diagnosis something many families put off, sometimes for years. This year, that started to change in a meaningful way. To understand this new test, it helps to understand two words you may have heard before, amyloid and tau. Think of amyloid as a sticky residue that can build up between brain cells over time. In small amounts, it doesn't seem to cause much trouble. But in some people, it builds up into clumps, called plaques, that researchers believe interfere with how brain cells communicate with each other. Tau works differently. Picture tau as tiny support beams inside each brain cell, helping keep the cell's internal structure steady. In a healthy brain, those beams stay organized. In Alzheimer's disease, tau can become tangled and twisted, and those support beams stop doing their job properly. Both of these changes tend to happen years, sometimes over a decade, before someone notices any real memory trouble. That's actually the whole reason this new blood test matters. It's designed to pick up on some of these changes earlier and more easily than we could before. Real-life scenario. Let's imagine a fictional example to make this clearer. Picture a man named Robert, 71 years old, married for over 40 years. His wife Linda started noticing small things. Robert would ask her the same question about their grandson's soccer schedule 2 or 3 times in one afternoon. He got turned around one evening driving home from a restaurant they'd been to dozens of times. On their own, none of these moments felt alarming. Together, over several months, they felt different. Linda mentioned it to Robert's doctor at his next checkup. In the past, the doctor's next step might have meant a long wait for a specialist and a conversation about an expensive scan. Now, because Robert was over 55 and showing signs of cognitive change, his doctor had a new option to consider first, a blood test that could help clarify whether this looked more like normal aging or something that deserved a closer look. This story is fictional, but it reflects a conversation that is genuinely becoming more common in doctors' offices across the country. Main health points. So, what is this test specifically? It's called the Lumipulse GP217 ratio test, and the FDA cleared it for adults 55 and older who are already showing signs of cognitive decline. It is not a general screening test for people without any symptoms. Here's how it works. The test measures the ratio between two things in a blood sample, a form of tau called phosphorylated tau 217 and beta amyloid. That ratio gives doctors a window into whether amyloid buildup is likely present in the brain without needing a brain scan first. In studies supporting its approval, a large majority of positive results, more than 9 out of 10, were later confirmed by either a PET scan or a spinal fluid test. That's meaningful accuracy for a simple blood draw, and it's part of why this is being called a real turning point. The practical benefit is significant. The question has now appeared. It will be a good perception of the plans of college and free union. For many patients, this blood test can now take the place of that expensive, radiation-involving PET scan as a first step. That means faster answers, lower cost, and an easier experience for patients and families who understandably weren't rushing to sign up for a full brain scan. But here's the part that matters just as much. A positive result on this test is a piece of information, not a diagnosis by itself. Doctors still look at the whole picture, including a patient's symptoms, other health conditions, and often additional testing before reaching any conclusion about Alzheimer's disease. Let's talk about why this actually matters and where the honest limits are. Earlier and easier detection matters because it can help families plan, and because a small number of newer medications are now available that are meant to be used specifically in early-stage disease when amyloid buildup has been confirmed. These medications don't reverse Alzheimer's disease, and they aren't a cure. What research shows is that for some patients, they may slow how quickly certain measures of the disease progress. This is a case where it's important to separate established evidence from an active scientific debate. It is established that these medications remove amyloid plaques from the brain. What's still being debated, seriously, among researchers is how much that translates into a meaningful day-to-day difference for patients. In fact, a major research review published earlier this year concluded that the effect of one class of these drugs on cognition was minimal, which has led to real, ongoing disagreement in the medical field about how these medications should be used and for whom. That disagreement is a sign of science working the way it's supposed to, not a reason to dismiss the research entirely. It's also worth knowing that no test is perfect. Earlier this year, one version of this blood test was affected by a manufacturing issue that led to a limited recall over concerns about false positive results in specific lots. That's exactly why doctors don't rely on a single blood test alone to make a diagnosis, and why this is discussed here as one useful tool, not a final answer. Families should also understand who this affects. Alzheimer's disease is estimated to affect more than 7 million Americans aged 65 and older today, and that number is expected to keep growing as more Americans reach their 60s, 70s, and 80s in the years ahead. This isn't a rare or unusual concern. It's a conversation more and more families are having. So what can you actually do with this information? First, if you or someone you love has noticed real changes, not just an occasional forgotten name, but a pattern that's new and affecting daily life, write down specific examples, dates, what happened, how often. Specific details help a doctor far more than a general worry. Second, bring that list to a primary care appointment and ask directly whether further evaluation makes sense, including whether this newer blood test could be a reasonable first step. Third, understand that this test is not something to request casually if you have no symptoms at all. It's currently intended for people already showing signs of cognitive change, so let your doctor guide whether it applies to your situation. Fourth, if a result does come back positive, ask your doctor to walk you through what it does and doesn't confirm, and what the recommended next steps would be. You deserve a clear explanation, not just a result on paper. Let's clear up a few common misunderstandings. Myth: a positive blood test means someone definitely has or will get Alzheimer's disease. Fact: it means further evaluation is warranted. Many people with some amyloid buildup never develop significant symptoms, and doctors still need the full clinical picture. Myth: this test is now available for anyone curious about their future risk. Fact: right now, it's approved for people 55 and older who are already showing symptoms of cognitive decline, not as a general early warning tool for healthy people. Myth: because a blood test now exists, a diagnosis is quick and simple. Fact: it's an important new piece of a larger puzzle that still typically involves a doctor's clinical judgment, family input, and sometimes additional testing. It helps to know the difference between ordinary aging and changes that deserve a conversation with a doctor. Misplacing your keys occasionally or blanking on a word now and then is common and usually not a cause for alarm. What deserves attention is a noticeable pattern repeating the same questions frequently, getting lost in places you know well, real difficulty managing familiar tasks, like paying bills or following a recipe you've made for years, or a change in personality or judgment that others around you have also noticed. If a pattern like this shows up and it's affecting daily life, that's worth bringing to a doctor, calmly and without panic. 3 things to remember. 1. This new blood test is a genuine step forward, offering an easier and often less expensive way to check for signs of Alzheimer's-related changes in people already showing symptoms. 2. A result from this test is one piece of information among several, not a standalone diagnosis. 3. The medications tied to this type of testing can slow certain markers of disease progression in early cases, but they are not a cure, and researchers are still actively debating how meaningful their day-to-day benefit is. If you found this helpful, and you'd like clear, honest explanations like this one, without the scare tactics, consider subscribing. We focus on the kind of information many people wish their doctor had more time to explain. If you know someone, a spouse, a sibling, a friend, who has been worried about a parent's memory, or their own, please consider sharing this video with them. Sometimes the most useful thing you can offer someone is simply clarity. As always, please speak with your own doctor about any symptoms, tests, or treatments that apply to your specific situation. This video is meant to inform you, not replace the care of a medical professional who knows you. Dr. James Carter is a fictional AI-created health educator, not a real doctor.